This is QT Clinic. Hi, I'm Dr. Jack Cush, Executive Editor with RheumNow. QT Clinic is brought to you by RheumNow.live 2025, February 8th and 9th in Dallas, Texas. You know, my voice is strange today, huh? I have a little scratchy thing going on. I think I'm talking too much. We got a great session at RheumNow.live on Saturday the 8th on JAK inhibitors. Let me just read this to you. I mean, John Giles talking about what we learned from oral surveillance 3 years later. Maddie Feldman's talking about when JAK inhibitors go generic. TYK2 inhibitors from Joe Marola, a derm person at UT Southwestern. And then Christina Charles Shulman is going to talk about JAK inhibitors and dermatomyositis. That's an exciting session. Today's case is a patient who I scratch my head about frequently. She's 30. She has the diagnosis of ANA negative lupus. Yeah, I know, it's in my chart. And Sjogren's syndrome and fibromyalgia. And when I see her, she's pregnant and she's in for follow-up and having some complaints. ANA negative lupus, you say. Yeah, the diagnosis was made prior to seeing me when she presented with arthralgias, arthritis, serositis, an ANA that was weakly positive once and then repeatedly negative 2 or 3 times. But her other serologies showed a positive SM, RNP, SCL70, double-stranded DNA, SSB, lymphopenia. She had nasal ulcers, photosensitivity, Raynaud's, and Zika symptoms. When I've been seeing her, she's repeatedly ANA, SSA, rheumatoid factor, APL antibodies, lupus anticoagulant, RPR negative. Double-stranded DNA was also negative since I've seen her. So what's going on? Well, right now she's doing fair. She has some joint pain. Her pain is an 8 out of 10. Her sleep is only fair. She complains of stiffness, has 60 minutes of morning stiffness. She also has some fatigue, dry eyes, dry mouth, recent URI. When I examine her, she has no rash. She has no oral ulcers. Her chest and lungs are clear. She has atender joints, no swollen joints, a CDI score of around 20. When you look at her labs, she has no cytopenias. Platelet count, white count, H&H are all normal, and her CRP is normal. And she's 5 months pregnant and having pains. So I'm going to focus on her sleep, do what I can, have her take analgesic medicines, which she's not doing. Right now she's on Plaquenil and folic acid, takes Neurontin at gabapentin at bedtime, and she doesn't take any pain medicine. So I can understand why she wouldn't want to with the pregnancy and all, but she can take Tylenol. And at this point, since she's only 5 months or 20 weeks or so, she can take nonsteroidals, but she's probably not going to want to do that. So here are the considerations here. 1, ANA negative lupus. I teach it doesn't exist. It's a figment of investigations prior to 1982 when the cell substrates for ANAs would allow for a negative ANA because you were missing Rho or La SSA, SSB positivity. The newer tests should not happen. And yes, it does occur. We've seen people at the university who would be ANA negative but still be positive for SM, RNP, and double-stranded DNA. Are they worse or the same or better? In general, if you're ANA negative and you got lupus, you're not gonna have a very consequential lupus course. And if you do, you're incredibly, incredibly rare. If they're ANA negative repeatedly, you should be looking to other diagnoses. So what's the deal with this patient? This patient has multiple autoantibodies. And in those people, I want to, one, look at whether they have liver disease, hepatitis C, hepatitis B amongst them. Second, whether they have other autoimmune disorders, especially Sjogren's syndrome, but you have to consider a myositis or scleroderma or an antiphospholipid syndrome. And again, this patient does have Sjogren's and probably does account for a lot of the autoantibody positivity. But the other thing is, are you treating lupus or are you treating fibromyalgia? We just recently reported a recent report that showed that, 15% or so, certainly less than 20% of lupus patients will also have coexistent fibromyalgia. And that needs to be managed, because if you're treating lupus when you should be treating fibromyalgia, guess what? They'll not do very well. If you're not treating fibromyalgia, their lupus treatment's not going to do very well either. Anyway, these are cases that we do see. Hopefully we'll see you at RheumNow.live. Maybe the best part is going to be the reception and Gong Show karaoke on Saturday night. That's right. I'm going to sing. Others are going to sing. We're going to score. There's going to be prizes. It's going to be fun, because education and meetings like this should be fun. We'll see you in Dallas on February 8th and 9th, 2025.